give you the question. This is your question now. Okay. So if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
As this is a patient of trauma, I will manage this case according to the ATLS protocol, Advanced Trauma Life Support Protocol.
Yes.
I will first, I will first assess the airway of this patient, and the patient is having on arrival, the patient was having the GCS 15, and now after 15 minutes, the with an episode of amnesia as well as the GCS is decreasing and it is 8, I will consider to intubate this patient.
Okay.
Uh,
Before
yes,
intubating, what would you do? Or is there anything you
I
would
will,
do?
yes, I will assess the airway first of all, look into his
Yes.
mouth and check any fluids or secretions or any blood or any foreign body, broken tooth present,
Yes.
and any mandible or multiple facial injuries if there is, and then I'll fix and I'll also side by side I'll also fix the cervical spine with the help of that hard collar and tapes and sandbags.
Yes. Then,
Then I will move on to the breathing part.
yes.
Then yeah, I will assess the patient, the respiratory rate, and chest wall movements, any open wounds present, and if present, I will occlude with the help of dressing, and uh, then I will auscultate with the help of stethoscope where the air entry is equal on both sides, and then I will connect if then I will connect to
Okay.
the oxygen if right.
Can you please explain what might be the cause of fall in the Glasgow Coma scale to 8?
It could be first of all due to the extradural hemorrhage, and there is accumulation of blood inside the in the extradural space, causing compression of uh, 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 the brain, and there may be compression of the ventricles due to which the GCS is decreasing.
Okay. Patient was or became amnesic or had amnesic event. Can you tell me what might be the reason for that? Or in other
Patient
terms, yes, can you define the term lucid interval?
Yes, it is the time period after injury to the brain during which the patient is conscious and it responds well. After certain period of this lucid interval, the consciousness certainly declines.
Declines. Okay. Can you tell me what are the clinical features if you have to determine patient is suffering from increased intracranial pressure? What would you look for?
Uh, I will look out for a headache, a patient is having nausea, vomiting, papilledema, or there is a fall in the GCS.
Yes.
There could be nerve compression in signs, palsies. There will be dilated pupil if there is a compression of third nerve, and there will be lateral gaze paralysis if there is a sixth nerve paralysis, palsy, and if there will be a Cushing's triad that will include the increase in the blood pressure, and there is a
Okay.
hypertension, irregular
Right.
breathing movement.
Thank you. Can you tell me what is the difference between Cushing triad and Cushing reflex?
Cushing triad is the hypertension, bradycardia, and the irregular breathing pattern. Uh,
And mhm.
Cushing's reflex is uh, uh, can we ask? Can we answer? Can I answer
We
this
can,
later?
yes, we can come back to this one later. Okay, can you tell me, according to the NICE guidelines, when exactly you should ask for CT head for this particular patient?
The patient has arrived initially in the emergency with the GCS of less than 13 or less than 15 after 2 hours on the from the presentation in the
Yes,
emergency, or the
yes,
patient
and
is having suspected open or depressed skull fracture, or there is this base of skull fracture having
good.
hemodympanum and battle sign and raccoon eyes and CSF motoria, rhinorrhea, and the patient is having
Good.
more than one
Just
episode of
suppose you've done CT scan for this patient and it comes out like this. How would you read it? Can you read it for me, please?
it is a biconvex hyperdense area, and
Yes,
there is a compression of the ventricles and the medlem shift.
compression and midline shift. All right, good. Can you please tell me what should be the normal value of intracranial pressure
It should be between the 7 to 15 millimeter of mercury.
in spine position? All right, can you
Right.
tell me, are there any ways you can measure intracranial pressure?
Yes, but there are two ways, invasive and non-invasive measures. Invasive measures include intraventricular catheter that includes extraventricular drainage, and it is the gold standard today. And others are other invasive measures include extradural probe and subarachnoid probe and interparenchymal probe. And the non-invasive measures include transcranial Doppler and the tympanic membrane uh, displacement
Can
methods.
you describe Monroe-Kelly hypothesis for me, please?
Monroe-Keeley hypothesis, it defines the skull a closed box. It will act as a closed box. It includes three components like fixed components like brain, which contributes 80% and 10% of blood and 10% of CSF. If there is increase in the edema or increase in the one component, there is a compensated decrease in the other component
Very good.
to accommodate.
Okay, good. Can you tell me, would you or would you not do the lumbar puncture for this particular patient?
If I do a lumbar puncture, there could be a herniation and coning in this patient.
Yes. So,
So it can lead to the respiratory paralysis and depression.
but my question was, would you go for lumbar puncture for this particular patient or not?
Uh, 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 I
No.
will not go to
Yes.
no, I will not go
Just
to
suppose patient does not have increased intracranial pressure and you are convinced that patient has some inflammation or infection and you have to do the lumbar puncture. What are the layers the needle will pierce?
skin, subcutaneous
Outside to
fascia.
inside, yes.
Yes, yes. Outside to inside skin, subcutaneous fascia, and then right at supra. Then
So we can come back to that later. All right. Can you
right.
tell me what are the you said while discussing the management that you'll intubate the patient. Can you tell me what are the indications for intubating the patient?
Yes, first is GCS is equal or less than 8, and the
Yes,
patient's internal pressure is increasing. The patient is agitated. Patient cannot protect his airway, and patients needs sedation. And there is a patient requires oxygenation as well as ventilation. Patient is having seizures, and there is bilateral mandible fracture.
okay. One last question. Can you tell me benefits of intubation? Bell has
Intubation.
gone. Yes, yes, please. Bell has gone. Yes, benefits of intubation.
In the there's improved ventilation and oxygenation, and the airway secured, and then there's a
Okay.
that's it.
Right. Good.
And
Right. All right. This particular patient, after a while, becomes hypertensive, bradycardic, and has irregular breathing. Can you explain what might be happening to the patient?
ma'am, can you repeat the question, please?
This particular patient, after a while,
Mm,
after 2 hours, say, or 1 hour, becomes hypertensive, bradycardic,
yeah.
and has irregular breathing. Can you explain what might be happening to the patient?
This is when the patient's tired, the patient is developing because of the increase in the intracranial pressure. It is inside the brain. It is developing.
Yes,
And there is a reduced cerebral blood flow.
yes. Then what would you do? You'll give?
Uh, in this patient, I'll manage the diuretics.
Yes,
Uh, and I'll manage the patient first of all by increasing the venous drainage of the patient by elevating the head in by 30
yes,
degree. Then the maintaining the head in a neutral position, and then reducing the cerebral edema by giving mannitol.
yes,
That is osmotic diuretic, and the other I can also give is loop diuretics, furosemide,
yes, yes. And you'll do the
and
fluid
anti.
restriction.
Yes, I'll do the fluid resection as well
Good,
as the yes.
good, nice.